from the book Treat Your Own Chronic Pain, the Chronic Pain Bible for doctors, psychologists and clients. A simple understanding of SDR therapy. The SDR therapy program has two aspects. Firstly, use SDR therapy techniques to discover and eliminate actual triggers to your chronic pain signals. Secondly, address issues that trigger or maintain stress because of the impact on sensitization. Some of these issues, for example, stressed, anxious, angry, guilty or sad feelings, can also be eliminated with SDR therapy techniques, while some, such as sleep dysfunction or relationship issues, will require typical sleep hygiene strategies or other problem solving and support. Intrusive thoughts can also be distressing, and these are generally quite quick and easy to resolve with SDR therapy strategies. If you're using SDR therapy successfully, including keeping your pain diary, you will typically still experience ups and downs in pain, including flaring from time to time. What you should notice over time, and for some people this is very fast, is that although there are ups and downs, the overall trend is definitely downward, with fewer and lesser flares until there is no pain and no flaring and no need for medication and full return to your normal life, sometimes with constraints if you've had an injury, surgery or other event which has altered your function, that is apart from pain. SDR isn't magic and can't return function, for example, where nerves have been irretrievably damaged. As amazing as SDR is, its use is specifically for elimination of conditioned responses, but luckily these types of responses are complicit in a host of things that bother us, not just chronic pain. Basic theory of SDR therapy. What is a conditioned response and how can we easily get rid of it? The mechanism or action of something triggering something else, like the smell of onions triggering salivation, is called a conditioned response, with the conditioned part meaning learned. Mostly we're not talking about things that we've consciously learned, like the date of your mother-in-law's birthday, for example, but things that we've just picked up unconsciously or practiced so frequently that it's become automatic. Conditioned responses can get created when something happens over and over through repetition. For example, if every time you ate an orange, you just happened coincidentally to get sick, pretty soon just the sight or smell of an orange would give you a feeling of nausea. Conditioned responses can also get created instantly if something is experienced intensely enough. Maybe when you picked up a piece of orange to eat, there was a wasp on it and it bit you, and now you can't bear the sight of an orange. Many of the symptoms of post-traumatic stress disorder are of this nature. In those cases, the event was traumatic enough that it only took one experience to create that conditioned response, or a whole set of conditioned responses. The key to understand here is that anything that happens repetitively while you're experiencing pain can get linked to the pain and become a trigger to the pain. Also, anything that happens even once but traumatically enough while you're experiencing pain can get linked to the pain and become a trigger. And likewise, the pain can act as a trigger to feelings or behaviour. The bullet point list below has some examples of some of these things. Up until now, it was believed that these types of responses were kind of set in stone and very hard to get rid of. Certainly, no current treatment except for SDR is capable of achieving that kind of rapid elimination. SDR demonstrates that these responses are not set in stone at all, are in fact very fragile, because their existence is utterly dependent upon smooth replay, utterly dependent upon being allowed to run without disruption. You see, these responses don't actually exist anywhere in your brain. They aren't stored somewhere. They actually have to be recreated every single time in a process called reconsolidation. And it turns out that if you deliberately try to trigger a response and at the very same time introduce a very different stimulus, then you wreck the reconsolidation process. When you wreck the reconsolidation, not only does that stop the response in its tracks then and there, it eliminates the response permanently and the problem is gone, simply gone. The problem for people who are beginning to learn SDR is that initially they don't really understand just how varied, complex and abundant the various triggers, that is the conditioned stimuli, to their pain or depression or anger or fear or their urge to smoke or whatever can be. It can take some time of really observing yourself to discover what these are for you, because everyone is so different. And this is especially where the help of a psychologist formally trained in SDR can be critical. Here are some examples of types of things we've found to have been triggers to clients' pain. Perception or awareness of the pain. This could be the sight or thought of a body part where the pain resides, a feeling of movement or of that part or pressure on it. Metaphors, stories that you might not even realise are running in your head around the pain. This could show up in your language or might only become apparent when you ask yourself what this pain feels like. Common ones are like ants crawling, a little man in there stabbing me, it's knife-like, that kind of thing. Overlapping metaphor is language, the actual words that you think to yourself or even say which relate to the pain. Examples are, I just can't stand this burning, this pain is driving me nuts, etc. Language might include anything at all that you typically think or say in relation to pain, including swear words. Language can become triggers. Beliefs around the pain, its causes, what it means, what it may mean for you in the future. Emotional states which clearly make the pain worse. You might even now already have a good idea about what these are initially. These need to be explored. Particular people or situations, including traumatic events from the past. For example, a car accident or traumatic betrayal. And there may be many others because, like I said, everyone is different. So in SDR therapy, we're going to deliberately bring each of these precise thoughts or perceptions to mind, one at a time, and at the very same time execute a technique which is designed to in some way disrupt that reconsolidation phase and thereby eliminate the conditioned response and the pain along with it.